Alpha. Yes, I'm fine. No. How are you? Yes, so my family, they are doing well. Thank you for asking. Yes, everybody. Hello, Prissy. How are you doing? Good evening. Diana, good evening. How are you? Welcome, welcome, welcome. Here is the rest of the population. How many are we here? 12. Let's give them 5 minutes. Gliz, how are you? Welcome. Alex. How are you doing, Alex? Welcome. Good evening. How many are we? We have 17. Okay. Let's give them 2 more minutes. Please tell them that we're about to start though. Candy, good evening. Sleepy. Hey. This is just 8 o'clock now. Wow. You worked all day? Sorry. Please go and make coffee. Let me give you 1 more minute to make coffee before we start. Please, if you don't have coffee, go and make coffee, guys. Everybody, please. Because you don't need to sleep, and I'll be very fast, like this. So I need cooperation, maximum cooperation from you guys, so that we'll be able to cover some of these things. All right. I'm great. Thank you, Mara. Thank you so much. Thank you so much. So go and get your coffee, guys. Because once we start, we've started. You know now, you know how it is normally. So I need you guys to, like everybody has to, attempt the questions. Everybody, please. Everybody here has to attempt the question. Even if your answer is the same thing with others, don't just leave it for others. Just still give, if your answer is B and everybody says B, put B. You understand? When the quantity of B is high, it encourages me that people are awake. Sometimes your answers are just easy to gauge how many people are actually listening and following. Do you understand? Because I know that there are some people at work, they may not, answer the question immediately when I ask it. So how fast people post their answers will determine, like, it will tell me, okay, people are with you, people are not with you. And once I notice that most of you are not here, I just cut it short. Do you understand? I cut it short. And it's sometimes, it will become a problem for the spirit. Hey, God, it's become a big problem for the spirit. Okay, guys. Do like this, do like this. Move it, move it. Mm-hmm. Take your coffee. Mm-hmm. It makes you active. Okay, guys. So where are we starting? Let's start from the last. I already did revisions for some others, so I strongly suggest we just discuss the topics we've not done before, and that should be it. The other ones you can always watch those videos. It's the same thing. All right. So which topic was the? Yes, 7 and 11. I think that makes more sense. Yes, 7 and 11. The other ones, just use the video. Go to my YouTube channel, go to live, follow the exactly, you see it, you read it, you listen to it, watch the videos, and you'll be good to go. I believe you must have done this thing over and over. You understand? So now it's just uh, muscular tissue, right? And bone tissue. Chapter 7 is bone tissue, then muscular tissue. Hold on, hold on. I think I'm listening to the spirit. I'm hearing something. Okay, the spirit is telling me that there. The spirit is telling me that there will be a lot of questions from muscular tissue. Hey, God. Eh, they move midterm to next week. Was it you talking on the spirits? I need to know the boldness. Okay. Guys, the spirit is saying, it's not saying I should move any midterm. The spirit is saying that a lot of questions is going to come out from muscular tissue. Alex, Alex said, please, spirit, I beg you. Alex, you're funny. Okay, guys. So it's nice to have all of you here again. This is March. Honestly, this year is running so fast, man. It's running so fast. No, 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 no. It's March. Before you know it, we are done. Oh. Okay. So let's test the microphone quickly. Please, the faster we go, the easier for us to catch a lot of questions, because these two topics, a lot of questions will also come out from them. Do you understand? And this is midterm. Sometimes your midterm could be 100 questions or more or less. It depends on what the spirit says. So I really need you guys to pay more than usual attention, to be very fast, because the more questions you do, the better. That's the truth. More questions, better. All right. So let's test the microphone. Let's start with this. All muscle types will respond to an electrical stimulus because all muscle cells are dash. Please, if there, anytime I say that I've posted a question and you can't see it, please tell me, because I don't understand why recently it's happening. So I just posted a question. All right. I'm not the options. I'll give you the options. So just pay more than usual attention. There are some questions I have to just say the options. It wouldn't make sense me posting it because it will waste time. The options. All right, so this question I just posted: all muscle types will respond to an electrical stimulus because all cells are dash. A, excitable; B, contractile; C, striated; D, involuntary; and E, isometric. Excitable, contractile, striated, involuntary, isometric. So let's go. Testing the microphone. This is your time to shine. Oh boy, I'm not teaching for people that has not been here before. I'm not teaching for today. No, I'm not. I've already taught most of these topics, so you can easily go to my system and look at it. You understand? What we are doing here is question and answer. We believe that you're already ready for your exam. So I want you to answer the question as if you are in the exam hall. You don't need to open any slide. You don't need to Google it. You don't need to use AI. You just need to pay attention and attempt your question. All right? All muscle types will respond to an electrical stimulus because all muscle cells are what dash. A, excitable; B, contractile; C, striated; D, involuntary; E, isometric. What is your answer, guys? This is testing the microphone, so I was expecting more than 20 people to respond. Yes, I just did. This is the first question. All muscle types will respond to an electrical stimulus because all muscle cells are dash. A, excitable; contractile; striated; involuntary; isometric. What's your answer, JB? Testing the microphone. I was expecting people. I don't want to start calling names. It's too early. It's too early. Right? It's too early, right? Portia. Portia Amara. And Kumbi, excitable. Okay, Portia has really finally answered. I was waiting for Portia to answer. Okay, yes, that's excitable. We are just testing the microphone. So let me give you another testing the microphone. The same options, guys. The same options. Look at this question. I just posted it. Skeletal muscle is called dash because it is usually subject to conscious control. Skeletal muscle is called dash because it's usually subject to conscious control. A, excitable; B, contractile; C, striated; D, voluntary; E, isometric. Excitable, contractile, striated, voluntary, isometric. Let's go, guys. Let's go, guys. Let's go. Let's go. Let's go. Let's go. Let's go. Let's go. Everybody's getting the answer today. Today seems to be a very good day. Today gonna be a good day. So we are still testing the microphone, guys. Perfect. The answer to that question is voluntary. Yes, you're so correct. So look at this question. Which of the following is not, pay attention, which of the following is not a characteristic of a muscle cell? Options. Yes, options. Yeah, Shena, you voluntary is correct. Which of the following is not a characteristic of muscle cell? Option: plasticity, contractility, conductivity, extensibility, excitability. Answer: A, plasticity, B, contractility, C, conductivity, D, extensibility, and excitability. What was the answer, guys? Perfect. The answer is plasticity. All right. You need to understand the universal, 5 universal characteristics of muscle. All right. I'm not going to ask more questions on this. That's why I'm just explaining so that you can use this explanation to answer every other question that will be asking you about characteristics of muscle. We have excitability. That's the ability of muscle to receive and respond to stimulus. All right. Then we have conductivity. All right, which is like once muscle is excited, the muscle cell must be able to conduct that electrical impulse along its entire length to ensure contraction. That's the meaning of conductivity. Then when you talk about contractility, it's just a unique ability to shorten substantially. You understand? When stimulated, it's to shorten, it's to contract. All right, just like a mechanical pull that creates movement. Very important that you understand this. Then when you talk about extensibility, all right, it's the ability to be stretched or extended, without being damaged. Make sense? Sorry. Then elasticity is the ability of a muscle cell to recoil and return to its original resting length after being stretched. So the question is, why is plasticity odd? Despite the fact that in medicine we use plasticity like neuroplasticity, all right, or sometimes cell having plasticity. Yes, plasticity ability to take different forms, but muscles, you understand, are usually defined by elasticity, not plasticity. You understand? So plasticity generally refers to a permanent or semi-permanent change in shape or function. Muscles, they don't change permanently, they return. All right. That's why it's what? Elasticity, not plasticity. Plasticity is a permanent or semi-permanent change. You understand? But elasticity is not a permanent change. If you stretch muscle, it comes back. That's why I can flex and extend, flex and extend. I hope it makes sense to you guys because I'm not asking any question under this particular section again with this explanation. I'm jumping this. Okay, another test of the test the microphone question. I shouldn't be giving you option for this question. I should not. Look at the question. A bundle of muscle fiber is known as a dash. Quickly. A bundle of muscle fiber is known as a dash. Known as a yes. A bundle of muscle fiber is known as a dash. I shouldn't be giving options. No, I can't give you. Why should I give you options of muscle fibers, the bundle? Come on now. Something you should know. Okay, fine. Since Afua asked. A, fascicle, B, myofibril, C, sarcomere, motor units, and myofilaments. Quickly. Perfect. You guys are so correct. The answer is fascicle. So you need to understand, like when you are doing these questions, you need to understand what each component means. All right. So like fascicle is just a bundle of muscle fiber, right? Very, very important. Like a lot of muscle fibers together. That's fascicle. You get it? The muscle fiber is just an individual cell. Chicken, huh? Do you understand? The myofibrils are components that make up what? Muscle fiber. I don't know if it makes sense. Myofibrils make up muscle fiber. Muscle fiber make up fascicle. Fascicles, group of fascicles make up what? A whole muscle. You understand? Now, I mentioned that myofibrils make up what? Muscle fiber. All right, they are like thread-like organelles. Now, sarcomere is the functional and microscopic unit of a contraction. All right, while myofilaments are what makes up myofibril. So I think you should start from actin and myosin. They are what? Myofilaments. So myofilament makes up myofibril. Myofibril makes up muscle fiber. Muscle fiber makes up fascicle. Fascicle makes up whole muscle tissue. I don't know if it makes sense. It should make sense to you. All right. I'm taking time to explain this because there are a lot of questions like that, and I'm jumping them because there are a whole lot of questions on muscle, and I really don't want us to stress too much. So the bundle of muscle fibers is known as what? A fascicle. Okay, look at this question. Very interesting question. Yes, the answer to that question is fascicle. Look at this question. Very interesting. A myofilament that runs through the core of a thick filament and anchors it to a Z disc is called A or and dash. I need you to pay attention and understand this question, guys. A myofilament that runs through the core of the thick filament and anchors it. Pay attention. It anchors the thick filament to a Z disc is called what? Let me give you options. A, myofibrils. B, thin filaments. C, T-tubule. D, sarcolemma. And E, elastic filaments. I know you want me to call the option again. I'll call it for you. It's okay. Don't stress yourself. I'll call the option again for you. A, myofibril. B, thin filaments. C, T-tubule. D, sarcolemma. And E, elastic filaments. I've repeated the option. No? Don't tell me it's because of the option that made you not to get it right. Oh yeah, let's go, guys. What are they thinking? Can you see the questions? I believe you can see the questions. A myofilament that runs through the core of a thick filament and anchors it to a Z disc is called dash. Myofibril, thin filament, T-tubule, sarcolemma, elastic filament. Yes, we can see. Okay. What's the answer, guys? Yes, the answer is elastic filaments. All right. It's very important that you know that. So look at this question. Yes, the answer is elastic filaments. Yes, D. Look at this question. The sarcolemma of a resting muscle fiber is most permeable to what? Resting muscle fiber. Resting muscle fiber is most permeable to calcium, potassium, sodium, lithium, magnesium. Which one? Like you should be giving me the answer like this. This is how I want it. Pium. Immediately I thought, pium, pium, pium. Do you understand? Like in the exam hall, you may not have time to overthink. Don't overthink. You understand? Just pick up the right word from the question and use it to get your answer. The sarcolemma of a resting muscle fiber is most permeable to dash. A, calcium, potassium, sodium, lithium, Magnesium. And what are you thinking in this question? You are thinking of what? Resting. Every other thing doesn't matter. What you are thinking is what? Resting muscle fiber. Resting. The muscle is what? At rest. So you ask yourself, which electrolyte, right, is which ion or electrolyte is active in a resting muscle fiber? Do you understand? Which one controls the muscle fiber at rest? You get the one at rest, at rest, at rest. Come on, guys. Okay, I'm seeing potassium, I'm seeing calcium. Come on, come on, come on, come on, come on. If you don't answer, I'll start calling your name. Oh. So, Jazz, have you answered? Have you attempted? No. Where is Yolet? Yolet has not attempted. Where is Sheena? Sheena has not attempted. Where is Prissy? Is she taking coffee? Okay, Prissy has attempted. Okay, she said K. Okay. Where is everybody? Okay. Okay, guys, you guys are so correct. The answer to that question is what? Potassium. Remember, I told you potassium at rest. The fact if you just say at rest, it is potassium. Do you understand? So, you just need to know the formula to get these questions so that you don't overthink it. Okay, look at this question, guys. I'm going to pose the options to you. You are here? Okay. I'll pose the options to you. Look at this question. Look at the question there. Option 1, incoming. Is option 1. Option A. Option B is incoming. I should go and release the music. That's option B. Option C. Option D. And option E. Answer, guys. The question, which of the following is true regarding the sarcoplasmic reticulum? It ensures the sodium needed for muscle contraction. It stores the sodium needed for muscle contraction. It synthesizes and stores ATP. It helps to maintain the resting membrane potential. It releases acetylcholine into the synaptic cleft. It releases calcium when a muscle fiber is excited. Come on, guys. Let's go. Come on. Yes, that reminds me. If you are not sure of the answer, please write not sure. All right, or write 911. All right, emergency. Anyone that works for you. Come on, guys. I'm getting low feed. Why? Just 5 people. Come on now. You want me to keep calling names? I cannot keep calling names. It's not sustainable. Is that all? Yes, the answer is E. It releases calcium when muscle cell is excited. All right. Remember, I told you about the two sisters. That's the cysteines. Cysteines are like this, right? Cysteines are like this. What are cysteines? Cysteines are the end parts of the what sarcoplasmic reticulum. Then there is one T in the middle, which is the T tubule. All right. So action potential comes from the sarcolemma and enters the T tubule. Immediately it enters the T tubule, then the end parts of the sarcoplasmic reticulum, each of them, that's the systems, they contain a lot of what calcium. The calcium, immediately they see the ATP, they jump inside to go and hold the the troponin, which cuffs the tropomyosin to open the active site of actin. Then myosin laps on the active site of actin to cause what contraction. So what that sarcoplasmic reticulum is actually a type of smooth endoplasmic reticulum, not rough. It's actually a type of smooth endoplasmic reticulum that is responsible for this action. It stores calcium. It has nothing to do with sodium. All right. Okay. I believe this is well noted. So it releases calcium when the muscle fiber is excited. Okay. So there's a question that's talking about the T tubule. Remember, each T tubule is flanked by what? Two sisters. Terminal what? Cysteines. Those two sisters, T for terminal. Terminal cysteines. Cysteines is spelled out Cisterns. That's cysteines. Cisterns. Okay, so that you remember, because I don't want to ask that question. And you know that myosin is the thick filament, actin is the thin filament. All those ones are simple question. Okay, look at this. Why is there so many this thing? Testing the microphone question. Why? It looks so easy. Which of the following marks the boundary of a sarcomere? I band, H band, Z disc, M line, A bands. Which of the following marks the boundaries of a sarcomere? This question, before I finish asking it, I thought everybody would have put in their answers. Which of the following marks the boundaries of a sarcomere? I band, H band, Z disc, M line, A band. Okay, the Z disc. Answer Z disc. Yes, you are correct. Z disc, 2Z disc is sarcomere. All right. Look at this question. I'm not giving options. Which of the following contains overlapping thick and thin filaments? Use the same options I gave before. Which of the following contains overlapping thick and thin filaments? A band, IH band, I band, M line, Z disc. Quickly, guys. Since we are wasting time, why are we wasting time? Are you guys not in the spirit? You need to be in the spirit, guys. I told you, when we start, let's push it forward. All these things are just peripheral questions, so that we could go to the main questions. These ones are just to activate you, to excite you. You understand? To generate an action potential in you. Let's be faster, guys. We are slow. Let's be faster. Yes, the answer is A band. But I'm expecting much more comments than this. This is too small, so we need more comments, all right? The answer is A band. Okay. So look at this question. And look at the options. Look at the options, guys, quickly. In skeletal muscle, the term that describes the alternating light and dark bands is dash. Strabismus, striations, tetanus, myofibrils, myoblasts. Which one? What's the answer, guys? Yes, the answer is striations. Okay, look at this question. The answer is striations. Look at this question. Yes, the answer is striations. Correct. Yeah, striations is B. Look at this question. The protein that acts as a calcium receptor in skeletal muscle is dash. I'm not supposed to give options, but let me just give options for the sake of Christ. F-actin, like F-actin, tropomyosin, troponin, tyrosine, dystrophin. The protein that acts as a calcium receptor in skeletal muscle is what? One, two, three. Only three people. You can't see the question, but everybody's answering. The protein that acts as a calcium receptor in skeletal muscle. I actually posted the question. Surprised you can't see it. This stuff has started happening again. It's annoying. Wow. Maybe it's the stuff that was happening yesterday. Yes, the answer is troponin. All right, that's the door handle. You remember? Yes. So look at this question. Just okay. Yeah, the answer to that question is troponin. Look at this question. If you see, tell me yes before I start posting the options. Can you see the question? If you see it, tell me yes before I start posting the options. Yes. All right. Perfect. This is option 1, option A, option B, option C, perfect, option D, and perfect. Thank you. Option E. So those are the options. They say, where is dystrophin? That is the protein that is effective in muscular dystrophy normally found. Where is it normally found? Dystrophin. Bridging the gap between the sarcolemma and the exantheminal. So which of the options? Option A say between the outermost myofilaments and the sarcolemma of a muscle fiber. B, as a transmembrane protein of the sarcolemma. C, in the Z disc of skeletal and cardiac muscle. D, in the dense bodies of smooth muscle. Then E, bridging the gap between the sarcolemma and the exantheminal. Oh, okay, that's what you said. Oh, bridging the gap between sarcolemma. Okay. So which one is the answer, guys? I want to put A, question mark. B, as a transmembrane protein of the sarcolemma. D, in the dense bodies of smooth muscle. Okay. D, dense body. Okay. E. More answers, guys. More. I need to see more comments. Okay, guys, the answer is A. Extremely important. That is between the outermost myofilaments and the sarcolemma of the muscle fiber. You need to understand the role of dystrophin, guys. Dystrophin is, a very big, massive structural protein. And what it does is that it acts as a link, all right, or a shock absorber. I need you to get it like that. It acts as a link or a shock absorber within the muscle cell, right? So it's actually located. So this is the sarcolemma, all right? This is the sarcolemma. That's the outermost membrane of a muscle. Dystrophin is located under it. I don't know if you understand. In the inner surface of it, this surface, that's where it is located. So muscle cell membrane, that's where it's connected. And what is it connecting? So one end, this first part, is connecting to, the F-actin of the outermost myofilaments. That's the cytoskeleton. But the other side, inside, is connecting to, a cluster of proteins in the sarcolemma. Do you understand the point? So the function is that, as a muscle contracts and relaxes, dystrophin, it transfers the force from under this place to this place. Does it make sense? So it transfers the force of that contraction from inside of the cell to the outside of the cell. Do you understand? So when there is mechanical stress on the cell during movement, the cell does not tear apart. It's the function of dystrophin. It transfers that stress. So there is a stress here. It transfers that stress from here to here. Simple. So it's like a connector, just like this. You see? So it transfers the stress from here to this guy here. You understand? So it neutralizes the stress. So it serves as a what? An absorber, stress absorber. So without it, you start having all these dystrophies, Duchenne muscular dystrophy and the rest of them. So extremely important that you guys understand this concept. I just need it. So it's found between the outermost myofilaments and the sarcolemma of what? A muscle fiber. Extremely important. Look at this question. I'm not supposed to give option in this question. Honestly, like there are some questions that shouldn't be wasting my mouth to give option. I just posted the question. I hope you can see it. The question says, please, if you cannot see it, always tell me, all right? The question says, how many somatic motor neurons stimulate one muscle fiber? How many? 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Option A to Z. This is nice. Why am I getting answers from only 5 people? Why? We are wasting time. Oh. You guys are really wasting time. Oh. It's already 48 minutes and we are just in a few questions. Some people will be like, Professor, just move keep moving. No. No, it doesn't work like that way. It has to be me and you. It has to be both of us communicating. Do you understand? It's a two-way thing. So, and the only way you can communicate is by putting it down there. I need to know if you are here. Yes, the answer to that question is 1. You understand? How many somatic motor neurons stimulate one muscle fiber? It can only be what? 1. But that muscle fiber can be stimulated by, one motor neuron can now stimulate a whole lot of muscle fibers, because they will ask you a question like that. Okay, look at this. Look at this, guys. Did you see the question? Yes. This is options. Normally, I'm not supposed to give option, but let's give option. No. Hold on. This is options. The process of engaging more motor units to increase the strength of a muscle contraction is called dash. Wave summation, recruitment, temporal summation, incomplete tetanus, complete tetanus. The process of engaging more motor units to increase the strength of a muscle contraction is called dash. If you can see that question, then I just posted the option under it. Wave summation, recruitment, temporal summation, incomplete tetanus, complete tetanus. Let's go, guys. Let's go. Let's go. Let's go. Where's everybody? You know, since we've started, Gliz is always the first person to answer questions here. Maybe we'll start giving prize to the first person that answers question all through the discourse. Yes, guys, the answer is what? The answer is what? Let me get one or two more persons. Yes. He said 10 point. Ha. What if that person happens not to be my student? Maybe we'll look for a way. I will plan it with YouTube so that YouTube can give that person maybe an advert-free subscription. I heard something like that, but I will look into it. Yes, the answer to that question is recruitment. B. All right, B. Look at this question. Now we are entering the main question. You know, the others we are testing the microphone question. Say 10 points. Are you sure it's not you and Glitz? You are not the same person. This one you're advocating for Glitz. I just posted the question, guys. He said thank you. I just posted the question. As you are lifting a box, someone places extra weight on top of it. For your muscle to continue contracting and lifting the box, the muscle must what? Let me give the options. You say thank you. This is A. This is B. This is C. This is D. And this is E. Alpha answered first. How? Hey. These 10 points that somebody said, that Portia said, has triggered Alpha. Impossible tense. This is good. Okay, let me check. Alpha has been so fast today. Let me see. Here she was number 3. Here she is number 4. Here she's number 2. Here she was number 1. No, number 3. Here she was number 10. Here she was number 10. Okay. Afua is doing magical. Your internet is working better. The Lord is good. Hey, God. Where were you before? You were in Africa? You're in Niger? You're in Ghana? Please, I didn't want to say Ghana before they'll come and drag my page. They say, this Nigerian guy is talking against Ghana. Let's come and drag his page. Please, oh. Okay, guys. Yes, the answer is A. So, you know, recruiting more muscle fibers. That's exactly the idea of what? Recruitment. Okay. So let's go to more serious questions. Oh, Cap, how are you doing? Welcome, longest time. Welcome, eh? So, Alex, yes, you are correct in that question. Recruitment. Look at this question I just posted. I'll give you guys the options. I'll give the options. I hope you can see the question. Welcome. This is the option. This is option A. Yeah. So this is option A. This is option B. This is option C. This is option D. And this is option E. So the axon terminal releases acetylcholine into the synaptic cleft, which is received by receptors on the motor end plates. Which structure does this describe? Afwa is on fire. There's nothing anybody can tell me. Come on, guys. Come on, guys. Come on, guys. Okay, yes, the answer is D. Guys, listen, a neuromuscular junction of a skeletal muscle, we already know the anatomy, right? Remember, listen, guys, let me use this thing as an example. As I told you initially, if this is the nerve, all right, this is the nerve, or neuron. Now, this is axon, all right? The action potential is coming down from the axon like this. Remember, action potential was formed here, correct? Sodium influx, potassium efflux, sodium influx, potassium efflux, local potential, then become action potential. The action potential now go pew. So now this is the knob. You understand? The knob, that's the end part of that axon. The end part of that axon. Inside the knob, all right, you have the vesicles. You get, when the action potential comes here, it opens the calcium channel. Calcium enters inside, busts the vesicles. The vesicles contains what? Acetylcholine. Pushes them out through exocytosis into this space. This space is known as what? Synaptic cleft. Now, the space between this guy here and the muscle, look at the muscle here. Remember, this is the nerve. This is the muscle itself. The space between this end and this guy is known as what? Neuromuscular junction. And this little space in between them is what? The synaptic cleft. But this big part is what? The synaptic knob. I believe you understand what I'm talking about. And when you talk about motor units, a lot of people don't understand what motor units is. Motor units, right, is, refers to one motor neuron. One neuron, you understand, plus all the muscle fiber it innervates. Does it make sense? One neuron. So, for example, if this is the neuron, an action potential comes like this. You understand? There can be one muscle fiber here, 1, 2, 3, 4, 5, 6. So, it can give action potential to the 6 of them. 1, 2, 3, 4, 5, 6. Do you understand? 6 of them. So this acetylcholine here, what does it do? It's acetylcholine here. We just swim across this synaptic cleft and go and attach the acetylcholine receptor in each of the muscle fibers. You feel me? Each of the muscle fibers. Immediately it attaches to each of the muscle fiber. What happened? Sodium channel open, sodium enters inside, closes, potassium open, comes outside, closes, sodium enter inside again. Just like that, until action potential is generated. And once it's generated, it enters through the sarcolemma, it enters the T-tubule. Immediately it enters the T-tubule, it pushes out the calciums and the cysteines, right? The calcium enters inside and go and hold the handle, door handle. That door handle is the troponin. As I taught you, troponin, open the tropomyosin, and contraction happens. So I just explained motor units so that you understand, because some people may be a little confused. But the answer to that question is the neuromuscular junction of a skeletal muscle. You must understand this. We already discussed sarcoma. We already discussed thick filament. Now, there's something we call varicosity of a smooth muscle cell, right? It's just a bulge. You understand? If you understand, the autonomic nerve fibers has bulges. We call them what? Varicosity. And what those bulges do is actually to release neurotransmitter over a wide area of a certain tissue. Do you understand? But that's not what we are discussing now. What we are discussing is what? Neuromuscular junction. Extremely important that you guys understand this. All right? Because you see a lot of questions based on that. Now, I've already discussed this as I was talking. I shouldn't have, but I have. I have already discussed it. Look at this question. I just posted the question. I hope you can see it, yes? Then this is the option. That's A. Yes, okay, thank you. That's B. That's C. That's D. And that's E. So what happens when acetylcholine stimulates the receptors in the neuromuscular junction? What happens, guys? Come on, guys. I will know people that are sleeping. Wake up, wake up, wake up. The spirit just told me that somebody is sleeping. What happens when acetylcholine stimulates its receptors in the neuromuscular junction? The release of calcium from the sarcoplasmic reticulum decreases, the permeability of the sarcolemma to sodium increases, the positive charge on the sarcolemma decreases, the threshold of the muscle fiber lowers, the inhibitory effect of acetylcholinesterase is overridden. Yes, the answer is B. The permeability of the sarcolemma to sodium increases. I told you now just some minutes ago. Immediately, I use this as synaptic knob. You understand? Action potential comes, opens, pay attention, action potential comes in the neuron or the nerve cell, opens. What action potential does, they may ask you in the nervous system. Action potential will open calcium channel. Calcium enters this synaptic knob and bursts the vesicles, push them out through exocytosis, right? Now, but this question is telling you, okay, the acetylcholine has entered the synaptic cleft. What does it do? Okay, yes. Acetylcholine, it says, what happens when acetylcholine stimulates? So acetylcholine will lap to the receptors, right? In the neuromuscular junction. And when it laps to the receptors, what does it do? You understand? As I mentioned initially, remember, the nerve cell inside it is at RMP, resting membrane potential, controlled by potassium, right? But this time around, sodium channel opens and sodium will rush inside and make it was negative instead of, and make it positive instead of negative. You remember it was negative. Potassium, despite the fact it's this positive ion, still makes the cell negative with other ions like protein and all those things. But potassium still makes it was negative. So immediately the channel opens, sodium channel opens, sodium what rushes inside. All right. So what happens when acetylcholine links with the receptor is permeability of the sarcolemma to what? Sodium. Sodium increase. It increases. So it opens up, sodium what rushes in. And once sodium rushes in, there's something we call what? Depolarization. Do you understand? And immediately the channel opens again, potassium comes out, repolarization. So you keep going up, down, up, down, up, down until it forms, it gets to the threshold, action potential is formed, and action potential enters through the T-tube. Okay. See, I'm repeating the same thing over and over again. That's how important this thing is. This thing is so much. So much, man. So much. Muscle is so much. I just posted a question. I believe you can see it. I hope so. This is A. This is B. This is C. This is D. And this is E. What's the answer, guys? Come on, guys. Why are we wasting time? I don't want us to waste time. Oh, guys, you guys should hurry, huh? What's happening to us today? Are we tired already? We are in muscle. Muscle is bulk. If the other parts are going to come out 5, muscle will come out like 2020. Muscle, and that's why I'm paying a lot of attention to it this night. So you really need to go with me, all right? Okay, so the answer to that question is actually A. The intracellular environment is what negatively charged. All right, this makes sense. Like I believe this makes a whole lot of sense because the resting membrane potential is the electrical tension. All of us know that is the electrical tension that exists, across the plasma membrane of a cell when it is not being stimulated at all. That's what we mean. And for skeletal muscle, it is minus 90 MV. Do you get? Your muscles cannot be tired though. Which of the following best describes the resting membrane potential, RMP? The intracellular environment is what negatively charged, yes. All right, I just said this a minute ago. The other plate, D says it's a voltage of about plus 75. No, it's minus 90. This one says, C says the extracellular environment is negatively charged. It's not true. It's actually positive because sodium is a lot in the extracellular environment. Then B says the intracellular environment has more positively charged sodium. Sodium is not even in the intracellular environment. It's actually in extracellular. That's why once it's, it enters, it causes what? Positivity. That's depolarization. Okay? Yes. So look at this question. I believe you can see this question. I want to put in the options for you. This is the option. So this is the option. The answer to what? The first one is A. The intracellular environment is negatively charged. I explained it now. So look at this one. The absence or inhibition of acetylcholinesterase at a synapse would lead to what? Flaccid paralysis, tetanus, atrophy, numbness, and muscle wasting. Let's see who gets this answer first. Come on, guys. If you don't know it, just write 911 so that I can explain. If I explain, it makes more sense to you, all right? You can catch the explanation and it will make a lot of sense to you. You can't see the options. The option is flaccid paralysis, tetanus, atrophy, numbness, and muscle wasting. And yes, the answer is actually tetanus. And I will explain because I see this question is giving a lot of people trouble. I will explain. Listen, guys. First, you need to know the role of acetylcholinesterase. That's the first thing. Do you understand? You need to know what the role of acetylcholinesterase. Second, you need to understand why the muscle stays contracted. Do you understand? If you know the role of our acetylcholinesterase, you know why the muscle stay what? Contracted. And so if a muscle contraction has happened, right? Pay attention. If a muscle contraction has happened, how do we switch it off? That's what they're asking in this question. So after a motor neuron releases acetylcholine, remember acetylcholine has been released from this end. You understand? A motor neuron has released acetylcholine, and acetylcholine has entered the synaptic cleft. What does it do? Acetylcholine will go and lap on the acetylcholine receptors to cause what? Sodium to enter, potassium to come out, sodium to enter, potassium to come out, leads to action potential in the muscle, then enters the T tubule, pushes out calcium, opens hold on troponin, opens tropomyosin, opens the active site of what? Actin, then myosin laps on it and causes contraction, right? Bam. So now contraction has happened. How do we stop contraction? How do we switch it off? That's the question. Now, there comes the acetylcholinesterase. Acetylcholinesterase is the off switch. You see this light? I can decide to switch it off now. Pium. That switch, for me to switch it off, is known as what? Acetylcholinesterase. Acetylcholinesterase switches off contraction. The question is how? How does it switch off contraction? First, you need to know what started that contraction. It was when acetylcholine laps to the acetylcholine receptor, correct? So acetylcholinesterase will just come, pick up the acetylcholine, and break it down into choline and acetyl. Chicken, huh? It will break it down quickly into choline and acetic acid. Do you understand? And the two of them go back to the vesicle. You feel me? So that is how acetylcholinesterase switches off the contraction. And immediately breaks it down. That means acetylcholine leaves the receptor. Then the muscle will do what? Relax. Mind you, the muscle is already contracted. But immediately acetylcholinesterase breaks down acetylcholine, the muscle will relax. All right? Now ask yourself, if a situation whereby, look at the question says absence or inhibition of acetylcholinesterase. What if there is no acetylcholinesterase? What will happen? Nothing to break down, nothing to switch off. So the muscle will remain what? Contracted. Sustained what? Contraction, continuous stimulation. So the muscle will be like this. Continuous contraction. That is what we call what? Spastic paralysis or what? Tetanus. Chicken, huh? That's what we call sustained contraction, spastic paralysis or what? Tetanus. Don't mind me, I have a big monitor here. That's why my eyes is going up. Do you understand? So that's spastic paralysis or tetanus, which is a continual forceful what? Contraction. All right? I hope we understand this. I believe we are. The opposite is flaccid paralysis. Is the opposite. Do you understand? So I hope this is clear. If you have any question, you can always ask me, but I will continue. And I explained it because there are some questions I want to jump like this. Bam. Thank you. So acetylcholinesterase is the switch off. It's just like this, my light, right? Me now, I want to switch it off, right? I just go and I switch it off. I am acetylcholinesterase. If I'm not around, even if I travel to Nigeria and stay in Nigeria 2 years, this light will remain on for 2 years because nobody will enter my house to switch it off. Right? So I am the acetylcholinesterase. And right now, the light is on, meaning it is contracted. So without me, the contraction has to remain like that. That's what we call spastic paralysis. Yes, she's laughing. Yeah, exactly. You get it? I believe you get it now. So I just asked a perfect. I just asked a new question. I need you guys to look at it. So the options, I'll give you the options. A, B, C, D, E. So, which statement best describes the goal of medications used to treat myasthenia gravis? A, to increase the number of acetylcholine receptors, to decrease the number of synaptic vesicles, to promote multiple motor unit summation, to inhibit calcium release from the sarcoplasmic reticulum, to inhibit the function of cholinesterase. Answer. Come on, guys. Yes, it means stopping, yes. Okay, guys. The answer to that question is E, to inhibit the function of cholinesterase. All right. Now, for people that we are not answering, they are not very clear about this particular thing. You need to first of all understand myasthenia gravis. What is myasthenia gravis? Myasthenia gravis is autoimmune disorder, all right, where the body's immune system mistakenly produced antibodies that attack and destroy those acetylcholine what? Receptors. Pay attention, guys. Remember I said acetylcholine comes out from here. This is a synaptic knob, goes to the muscle, right, and attached to the receptors, correct? Yes. A situation whereby your body destroys those receptors. You understand? It destroys most of the receptors. What happens? You understand? So you see, there are only few receptors available. So now, if the acetylcholine comes, okay, for example, maybe they are supposed to be like 100 receptors. So your body produces 100 acetylcholine. Those 100 acetylcholine will come and attach to the 100 receptors, right? To cause contraction. A situation whereby your body destroys like 70 of the receptors. So the 100 acetylcholine will come and, you know, there will just be 30 receptors left. You understand? There will just be 30 receptors left. So if there's 30 receptors left, I'm coming. What happens? You see? What happens? So there will not be enough, right? Contraction, because it is only just 30 receptors that will not cause contraction that is supposed to be for 100 receptors. So there will not be enough contraction. So gradually, muscle weakness and paralysis happens. Do you understand? This time around, it is flaccid paralysis because it is not what? Contraction. So that myasthenia gravis is a situation whereby contraction is not happening because there is no enough receptors. Do you understand? There is no enough receptors. Acetylcholine is enough, but receptors are few. So the drugs we give for this condition, remember, there is only 30 what? Receptors for 100 acetylcholine. Now, if acetylcholine stays for like 2 to 3 minutes, I'm giving an example, 2 to 5 minutes, for example, acetylcholinesterase comes and destroy all the acetylcholine, right? So now we will give a drug that will stop the acetylcholinesterase from destroying the acetylcholine. Do you understand? So if this person has only 30 receptors, we will give the drug to protect this acetylcholine, 100 acetylcholine, so that if this 30 laps on these 30 receptors and causes contraction, there will be time for the others. They will now be going turn by turn to cause contraction until the contraction is what? Enough. So the drug we give is to stop what will destroy the acetylcholine. That is acetylcholinesterase. We give a drug to stop it so that the acetylcholine that are remaining will have enough time to function. Example of that drug is pyridostigmine. That's what we usually use in the clinic. So its primary goal is to make the most of the signal that is still there. So what is mechanism of action? That's why I said if you understand physiology and anatomy, you will understand pathology, you will understand pharmacology, you understand medicine, and you understand surgery. It's as simple as that. So now you've understood the mechanism of myasthenia gravis. All right? Receptors are low, enough acetylcholine, but low receptors. So what do? We give a drug that will allow acetylcholine to have more time on the receptors. And the drug definitely will stop acetylcholinesterase because it is only acetylcholinesterase that can kill the acetylcholine, break them down. So we stop acetylcholinesterase for the acetylcholine there to have enough time on the little receptors that are left. Question. Okay, let me see. So A is impossible. You can increase the receptors. Let me see. Which of the following best describe the goal to increase the receptors of acetylcholine? No. How do you increase receptors? When you have problem with receptors, you have problem with receptors. Honestly, like just like diabetes type 2. You understand? Just like DM type 2. You have to understand, like acetylcholine, like the ACE, that acetylcholine is key, right? Acetylcholine is fine. But one angry tenant came and destroyed all the doorknobs. So think of the receptors like doorknobs. You have key, you have doorknob, right? You have to put the key inside. So all the keys are working. But one angry tenant came and destroyed most of the doorknobs, remaining very few. So that's how you think about it. Why for type 2 diabetes? All the doorknobs are working, but the door is jammed. You understand? And the key is working, but the door is jammed. So the key becomes useless, the door becomes useless. All right? So that's how you understand diabetes type 2. But for myasthenia gravis, the keys are working, but one angry tenant, one very, very angry tenant came and break down most of the doorknobs, remaining few doorknobs. So we are now trying to protect the key so that the key will have enough time to, penetrate the remaining knobs using what? Pyridostigmine. That is the idea, all right? Okay. I believe you guys understand it in case of if you see a question on that. So I'm using the opportunity to explain more. What muscle type depends on it? Okay. Look at the question. This question. I'm not giving option. Yes, got it. Thank you. Yes, understood. Perfect. Perfect. I'm not giving option for this question. Look at this question. I just posted it. During muscle contraction, binding sites for myosin are uncovered by the movement of that. These people are crazy, man. Honestly, see how they twisted this question to confuse somebody's child. So let me see. I'm not giving option. Don't ask me for option. During muscle contraction, binding sites of myosin are uncovered by the movement of what? if I remember correctly. Come on, guys. Is there only 3 people we have here? Alpha, Gliss, and Cap. Are they? Where is every other person? Is it because I didn't give option? Okay, fine. The options: tropomyosin, troponin, actin, ADP, titin. Tropomyosin, troponin, actin, ADP, titin. That's A to E. You can also add up the options, all right? Option F, Nchebe. Hey, this boy played too much, man. They succeeded in confusing me. Who confused you? Ah. They cannot be confusing you. You don't have time to be confused right now. Yes, guys, the answer is tropomyosin. Don't be confused. Let me explain this in the concept again. I told you when it's always like, do you know why I always go back to the synaptic cleft? Because that's where it all started. All right. Immediately the acetylcholine crosses the cleft and laps to the acetylcholine receptor. What happened? That's what you think. I told you sodium open, rushes in, causes depolarization, closes, potassium comes out, causes repolarization. Just keep going. Action potential is formed. The action potential now passes the T tubule, pushes calcium inwards. Calcium laps on the troponin. Troponin is door handle. Think about it as a door handle. That's what troponin is. So if they ask you where does calcium lap, calcium laps on the troponin, which is door handle. Now, the door handle is attached to the door, correct? That door is tropomyosin. So you guys are correct. The answer is tropomyosin. And what is tropomyosin? Tropomyosin is what? The door itself, covering the active site of actin. So immediately troponin, calcium turns the handle, that is troponin, it opens the tropomyosin, then the active site of actin becomes open and naked. Then the myosin now comes and what? Laps on it. You understand? Laps on it. And contraction happens. So the question says, during muscle contraction, binding size 4, not off. If it says off, then it has to be binding size of myosin. But this is binding site of myosin, binding site of actin, right? For myosin. Do you get it? Binding site of actin for myosin. For myosin. You understand? Just like somebody wants to get pregnant, you have to open up, be naked, open up, then this guy enters inside, penetrates inside, and get the person pregnant. That's exactly what happens here. All right? Yeah, very corrupt situation. You are laughing. Hey, Jesus. Evil people everywhere. Action potential for model size proposed along the. Oh, this one is simple. Increase ion permeability is caused by an action potential. No. Muscle contraction, calcium ions. You see that question I was telling you? During action potential, calcium ions bind to troponin. So this one is very straightforward. You understand? Somebody's laughing. Evil. At last, the release of acetylcholine from skeletal muscle. Skeletal muscle generates. Hold on, guys. Look at this question. You see, that's what I'm telling you. If you can understand the physiology, you will. I just posted a question. I believe you can see it. If you understand the physiology, then you understand even pharmacology. So you guys really need this thing for, that's why you need to open your head and understand this thing. You understand? Please. You need to be attempting questions as well. That's the best way to understand. Even if you get it wrong, that's fine. Okay, what is the answer? Drugs called calcium channel blockers may be used to lower blood pressure by causing arteries to vasodilate. How do you suppose these drugs work? A, they prevent calcium from entering the sarcoplasmic reticulum of the smooth muscle. They stimulate the calcium pump in smooth muscle, thus removing. Nah, this thing is too long. Please, I'm not reading it. Just read it by yourself. Somebody's laughing. Stop laughing. Oh, you thought I can't see you? I can see you. You're laughing. Stop. Me that is saying stop laughing. I'm busy laughing. I told you somebody's laughing. I cut cap. Okay, so that let us say a lot of blood vessels can pass through the arteries to the heart. Okay, since you said this, let me make you understand. So, this is asking about calcium channel blockers, right? How do they lower blood pressure? So the thing is, the heart is different from skeletal muscle. Skeletal muscle, what causes the contraction in skeletal muscle is the stored calciums in the sarcoplasmic reticulum. So internal calcium. But for cardiac muscle, that's the heart, you understand? And for vessels, it's usually for blood vessels, usually, or the heart, is external calcium. Do you understand? External calcium that causes constriction. I don't know if it makes sense. So calcium channel blockers, what they do is they block that calcium from coming in. They block it from coming into the vessel. You feel me? So if they block it from coming into the vessel, nothing will contract or constrict the vessel. So the vessel will be relaxed. That's how calcium channel blockers work. I don't know if it makes sense to you. I don't know if this explanation makes sense to you. So unlike the heart, unlike the skeletal muscle, the cardiac muscle and the smooth muscle, they don't have calcium storage inside them. But skeletal muscle has calcium storage inside it. You understand? It's being stored by sarcoplasmic reticulum. But heart and smooth muscle doesn't have that. So they rely on external calcium to make them contract. So calcium channel blockers block those external calcium. Perfect. You understand? We have two types of calcium channel blockers, right? For people that wants to know some pharmacology, we have two types. One are the ones that target the blood vessel. One are the others that target the heart. The ones that target the blood vessel, we call them what do we call them again? Dihydropyridines. They target blood vessels. The ones that target the heart are the non-dihydropyridines. You know these medications now, like amlodipine, Novas. I don't know, how do they call it again? Novas. You guys know amlodipine, right? It's very common. All this dipine, amlodipine, nifedipine, felodipine. All of them are calcium channel blockers, and they specifically target the blood vessel, not the heart. You understand? Then we have the one that target the heart, like the verapamil, diatizam. Do you understand? These ones are also calcium channel blockers that target the heart. So, like when you are doing pharmacology, you need to be able to understand: am I targeting the heart, or am I targeting what? The blood vessel? Which one am I targeting, and what is my goal? What do I plan to gain? Do you understand? That's how you make medication prescription. All right. But the most important thing is that you must know the MOA. That's mechanism of action of these things. Okay. So the answer is E. They prevent calcium from entering smooth muscle, thus allowing the muscle to what? To relax. Okay, look at this question. I have few questions to go, guys. Very, very few questions. But there is some specific questions I'm looking for. I just posted a question now. Which muscles can contract without the need of nervous stimulation? Skeletal muscle only, smooth muscle only, cardiac muscle only, smooth and cardiac muscle, skeletal muscle and cardiac muscle. Which one? Last one is skeletal, smooth, and cardiac. Which muscles can contract without the need of nervous stimulation? A, skeletal muscle only. B, smooth muscle only. C, cardiac muscle only. D, smooth and cardiac. E, smooth, cardiac, and skeletal. Perfect, guys. It's smooth and cardiac muscle. Smooth and cardiac. There is these two questions I just posted. This one, the first one, I hope you can see the two of them. The first one says resistance exercise will most likely cause muscle to dash. The second one says loss of muscle mass from lack of activity is called dash. Yes, smooth and cardiac is correct. So those two questions, I want you guys to answer it at once. Like put the first answer and the second answer. I'll give you the options. The options: myopathy, dystrophy, apathy, atrophy, tetanus. Just pick options from these things I just called. What else am I forgetting? Myopathy, dystrophy, apathy, atrophy, hypertrophy. Which one is the answer? Quickly, guys. Quickly. Yes, smooth and cardiac is correct. Honestly, this shirt is 5 years old. Honestly, like I came in late because I need to start the live, so I just look for something to wear. I wasn't wearing it a long time because I was so big, so the shirt does not enter me. But now I've lost weight, so I can easily rock the shirt. Thank you. Thank you. Yes, you guys are so correct. The answer is hypertrophy and atrophy. All right. The odd one out is apathy. Apathy is just a psychological or behavioral state. All right. Atrophy, we already discussed atrophy. Atrophy, that's the wasting away or decrease in size of a muscle. Dystrophy, we already discussed dystrophy, like when I mentioned specifically muscular dystrophy, Duchenne. You understand? It's a specific type of myopathy that is genetic and progressive. All right. Why, when you talk about myopathy, it's just a disease that originates in the muscle tissue itself. All right. Extremely important that you know this. So I want to pose this question for X. Look at this question. So look at the question there. Options. Okay, read the question. Okay, let me just post the option instead of just reading it out because I know people are still reading the question. Look at the options. So I just posted the question. I hope you can see it. Yes. Michael Jordan was arguably the best player in the professional basketball history. He excelled at jumping and sprinting down the court. Anatomically, one would expect him to have highly developed dash fibers in his lower limbs. Quickly. Red, type 1, slow oxidative, fast switch, and smooth muscle. What's the answer? Quickly, guys. What's not sure? Okay, yes, the answer is fast switch. Fast switch. Fast switch is switch option D. Yes, fast switch is D. All right. Look at this question quickly. The transfer of phosphate from CP to ADP is catalyzed by what? Myokinase, creatinine, CAMP, creatine creatine kinase and ATP. Yes, it's fast switch. It's actually fast switch. It's actually this question is actually very straightforward, honestly. We know now. They already gave you the answer. It's just a giveaway now. That thing is testing the microphone question. That's why I'm not gonna waste too much time explaining. But look at this one. The transfer of phosphate from CP to ADP is catalyzed by oh yeah, do like this. Do like this. Everybody. Do like this. Do like this. Do like this. Do like this. Touch your knee. I know, hope you are not on the bed though. If you're on the bed, you'll be feeling sleepy. Better go to the chair now. Do like this. Do stretching. When I finish losing weight, I'll open a new channel for gym. I'll be teaching people how to gym. Hey, Nchebe. So that you don't sleep. Yes, now. So that you don't sleep. I'll open a new channel. It's called Dr. Jim. That's what I will call it. Wake up, guys. Please, I'm being very particular about this because I've not reviewed this with you guys, and it's gonna be more questions from these two than from others, right? So when you finish reviewing these two, then you do others on your own. We've already done them before. Yes, the answer is creatine kinase. You must know the difference between creatine kinase and myokinase, right? Creatine kinase and myokinase. You must know the difference. Myokinase, creatine kinase. Myokinase, creatine kinase. All right. So creatine kinase catalyzes the transfer of a phosphate group from creatine phosphate. Do you understand? So it takes one from creatine phosphate, adds it to an ADP. You understand? So that's what it's and it's that ADP becomes what? ATP and creatine. So creatine phosphate, it breaks the creatine phosphate into two, drops the creatine, take the phosphate, adds to an ADP to form what? ATP. It's phosphagene system, one of the enzymes of phosphagene system. The second enzyme of phosphagene system, because they can ask you anyone, is myokinase, right? So myokinase takes 2 ADP. It brings 2 ADP like this. And, it doesn't like this one. Look at his face. I don't like this ADP. I don't like you. I really don't like you. What does he do? It will break this ADP. ADP is adenine diphosphate. That means he has 2 phosphates. It will break this ADP, take 1 phosphate from it, and give this ADP. The ADP will become what? ATP. So myokinase brings 2 ADP, takes the phosphate from 1 and add to this one. Do you understand? And that completes ATP. Make sense? Okay, so that's myokinase and creatine kinase. So for this one, what they're asking is creatine kinase. I have 3 more questions. 4 more questions to ask you here. And we are good to go. I want to make sure I've covered the entire thing. Anything they will ask you will be similar. Which of the following is true concerning concentric contraction? A, B, C, D, E. Quickly, guys. Why? Where is everybody now? Come on, guys. Let's hurry. Please, please. Come on, guys. Only 7 people. Yes, the answer is the muscle shortens, the tension remains constant. Now, use that particular option. I want you to use that option to solve this question. I just have 2 more questions to go, guys. Use that particular option. Give me the answer to this question. Yes, for that other question, the answer is A, not B, please. Yolet, the answer is A. That question says, which of the following is true concerning isotonic concentric? Concentric, the muscle shortens, but tension remains what? Constant. Then the second question says, which of the following is true concerning isotonic eccentric? Eccentric. The first one is concentric, which is the muscle shortens, but the tension remains constant. But this one is eccentric. What's the answer? Yes, for that answer is B, all right? So we are gradually coming. There's one question. That's one question that I'm looking for. So there is this, hold on, look at these two questions, guys. So that I want you to compare the two of them and tell me. I need you to compare these two questions. This is the first one. I just posted it. And this is the second one. So what I'm more or less I'm trying to do comparison. I want you guys to so give me the answers to these two questions. You understand? Together. What is the answer, guys? You want options? Fatigue, spasm, incomplete tetanus, complete tetanus, flaccid paralysis. You understand? I need you to pick the answer to the two questions. Fatigue, the same option. Fatigue, spasm, incomplete tetanus, complete tetanus, spastic paralysis, wave summation. What's the answer to the two questions? Come on, guys. Those are the two last questions so that we can jump over to bone tissue and we call it a day. Quickly, guys. Where's everyone? Should I start? Monica, Prissy, Yolet. Okay. Gliz is still here. Afwa has fallen off, finally. I was surprised. I was wondering if you're going to maintain this tempo. Gliz is still here. Shena, where are you? Sanya Forever, where are you? Vina Kayo. Okay, Vina Kayo has answered. Okay, sorry. Alex, where are you? Destiny. There are two questions, and I need you to answer the two of them. Jasmine, after your first switch, you disappeared. Did Portia answer? Let me see. Portia did not answer. I don't understand. You people are waiting for. Okay, you are here. You've not disembarked. Finally, Jasmine has talked. No, but you are supposed to be answering the two questions. There are two questions. You are supposed to give me two answers. You just wrote complete tetanus. Which one is complete? Which one is incomplete? Options. You want options? I can't even remember where I saw that question. Okay. Fatigue, spasm, incomplete tetanus, complete tetanus, flaccid paralysis, and wave summation. So it has to be two options, two questions. Oh, you did? Okay. Sorry. Okay, yes. So Yes. So that's the first one I asked. Let me see which one is the first one. If one nerve stimulus arrives at a muscle fiber so soon that the fiber does not relax at all. So soon that the fiber does not relax at all. If it doesn't relax at all from the previous twitch, it doesn't relax at all from the previous twitch. That's complete tetanus. So the first one is complete tetanus. First one is complete tetanus. All right. If it doesn't relax at all, don't let these two things confuse you because you don't know which one they will bring. The spirit can tell them to bring something. Do you get? But if you understand it, you are good to go. Then, if one nerve stimulus arrives at a muscle fiber so soon that the fiber has only partially relaxed, you understand? So it starts going up, going up, going up, going up. Staircase. That is what we call what? Incomplete what? Tetanus. All right, and that is how we come to the end of you thought I wanted to say that's how we come to the end of the review. No, that's how we come to the end of you need to know which one you are talking about. All right. If you didn't understand the explanation, please try to review and understand it properly. Okay, that's how we come to the end of muscular tissue. Let's go to bone quickly. That will be just few. I'll be asking. The spirit is just going to give you few on bone. Oh, it's not few. That is few. Are we ready? I hope we'll be more active than we were. Gliz, yes, I agree. You are very ready today. Gliz and Afua and Cap. The other people, I don't understand. They are saying yes, 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 and now you disappear. Let me try. Okay, let me try. Let me throw. Be bringing out tongue. Let me throw this question. Look at this question. Appositional bone growth is a process that. It's a process that does what? Options: A. B. C. D. E. Alex is back. Alex will be back in 5 questions and disappear for the remaining 20. Ah. Come on, guys. Come on. Your internet. Which internet is using? Is it called Afua internet? Somebody's laughing. Hey, God. Afroaric internet. Ha. Ready. I've already thrown question there now. So appositional growth, you guys are very correct. The answer is A, forms new bone on the surface of older bone. That's appositional growth. Remember that. And those new bone is actually deposited around blood vessel. Why is laughing? So please, that new is deposited around blood vessel. Please remember. Okay. So in the healing of a bone fracture, look at this. Which of the following is the correct sequence of events in the healing of a bone fracture? Extremely important question. Extremely important what? Question. So look at the options. A. Please, I need you to, everybody has to attempt this question. Please, if you don't know the answer, say you don't know the answer, but at least type in something. All right? So those are the options. Which of the following is the correct sequence of events in the healing of a bone fracture? So tell me, what's the answer, guys? Quickly, guys. Yes, the answer is C. Guys, so this thing is a very the correct sequence is hematoma formation, soft callus formation, hard callus formation, and then bone remodeling. It's very, very direct. All right. Think about it. When a bone breaks, right? Because a fracture actually tears the blood vessels, right, in the periosteum and bone marrow. So immediately it tears that blood vessels. There's a lot of blood, a clotted blood. That is what we call what? Hematoma. You understand? That's the first thing that happens. Like temporary plug, scaffold. You understand? So that their inflammatory cells will what? We arrive. Do you understand? Then after that, the fibroblast and the chondroblast, they migrate into the hematoma, right? That's the cartilage forming cells. They migrate into the hematoma, right? Then they produce collagen, fibrocartilage matrix that bridges the broken bone. Very, very important. That's soft callus formation. It happens like 48 hours to 3 weeks. Do you understand? Of that bone fracture. Then after that, what happens? Hard callus formation happens approximately 3 weeks to 4 weeks, 4 months. You understand? That hard callus is, osteoblast. That's bone forming cells. What do? They start immediately to replace what? The soft fibro cartilage, right? Aha. So it creates this hard bony collar around the fracture. Then after that, the bone remodeling, that's months to years, which is the final stage. It's a long-term cleanup process. You understand? Osteoclast starts removing excess debris, bulk, shaping the bone, arranging it, and that spongy part that was formed during the hard callus will be replaced by what? Compact bone. Extremely important. Okay. All these fracture questions. Okay. Look at this question. Look at this question, guys. The results of blood calcium and phosphate levels being too low for normal deposition is a softness of the bones called dash in children and dash in adults. The options: A, osteomalacia rickets; B, rickets osteomalacia; C, osteoporosis osteomalacia; D, osteomyelitis osteosarcoma; D, E, osteomyelitis osteomalacia. Answer. So it's very straightforward now. I shouldn't even have given options. Osteomalacia rickets, osteomalacia osteoporosis, osteomalacia osteomyelitis, osteosarcoma osteomyelitis, and osteomyelitis osteomalacia. Okay, osteomalacia rickets, then rickets osteomalacia. I don't know why I joined those two things together. So osteomalacia rickets, then rickets osteomalacia. Come on, guys. You guys are wasting time. Do you guys want us to be done at all? Do I have to call names for you guys to answer? Oh boy, I have to beg you guys to answer. Okay, yes, the answer is B. All right, the answer is B. It's rickets and osteomalacia. In children, it's rickets. In adults, it's osteomalacia. You understand? Which of the following is not a function of the skeleton? Not a function of the skeleton. Which one is not a function of the skeleton? This is A. This is B. This is C. This is D. And this is E. Which I follow is not a function of the skeleton. This one is very straightforward now. Just testing the microphone, guys. It's not serious. Yes, the answer is B. That one is not. This is a test of the microphone question. Testing the microphone question. All right. So this question I want to give, I just gave the option first because I needed to edit the option. So I had to give the option first. Then this is the question itself. So you use that first one I posted to answer the question itself. This is the question. The dash is an example of bone as an organ, and the dash is an example of bone as a tissue. We have femur spongy, we have spongy femur, we have skull marrow, we have compact sesamoid, we have red marrow compact. Answer. Yes, the answer is femur spongy. All right. The answer is femur spongy. So it's A. Look at this question. The cortex of the long bones diaphysis is made up of what? The cortex. We have marrow, we have compact bone, we have spongy bone, we have dense regular tissue, we have articular cartilage. Which one? The cortex of the long bones diaphysis is made up of dash, We have marrow, we have compact bone, we have spongy bone, we have dense regular connective tissue, we have articular cartilage. Quickly, guys, quickly. Yes, the answer is compact. The cortex, remember, cortex is outside, the inside is what? Usually the medulla area. So compact. Yes, the answer is compact. Look at this question, guys. The thin layer of slightly denser spongy bone that separates an adult's epiphysis from the diaphysis is called the dash. A, periosteum. B, metaphysis. C, growth plate. D, epiphyseal line. And E, diaphyseal line. The thin layer of slightly denser spongy bone that separates an adult's epiphysis from the diaphysis is called the dash. We have periosteum, we have metaphysis, we have growth plates, we have epiphyseal line, we have diaphyseal line. Come on, guys. Am I having any? I lied. I read the question D. Yes, the answer is epiphyseal line. Yes, they want to confuse you. The answer is epiphyseal line. So that's the question for the option for this question I want to post now. I just posted the option first. This is the question itself. The center cavity of the diaphysis of a long bone is called the dash. A, marrow cavity. B, central canal. C, nutrient foramen. D, canaliculus. And E, epiphysis. Come on, guys. Central canal. No, that's. I should say them again. I've even left the question. I'm bringing another question I'm supposed to ask. What did I ask initially? Okay, the center cavity of diaphysis of a long bone is called the dash. A, marrow cavity. B, central canal. D, C, nutrient foramen. E, canaliculus. And D, canaliculus. E, epiphysis. I posted it. What's the answer? No, that's fine. Yes, guys, the answer is correct. It's marrow cavity. All right, that's the center cavity of the diaphysis of the long bone. Is marrow cavity. All right. Why the expanded head is the, you see, this is how it is. This is the epiphysis and diaphysis. Okay, but look at this question I want to ask now. First of all, I'll pose the option. This is option. And this is the question itself. Yes, marrow cavity is correct for that question. This is question itself. A long bone is covered externally with a sheet called the dash, whereas the marrow cavity is lined with the dash. We have A, epiphysis, diaphysis, B, diaphysis, epiphysis, C, compact bone, spongy bone, D, periosteum, endosteum, E, endosteum, periosteum. What's the answer, guys? Come on, guys, let's go, let's go, let's go, let's go, let's go. Where is Alex? Your network is still giving problem. Portia, Yolette, Jasmine, Sanya, Destiny, Shena, Monica. Prissy. Okay, Prissy has already commented. Yes, the answer is the answer is D. Yes, you're correct. Periosteum, endosteum. That's correct. That's correct. I have a few questions to go from bone. Look at this one. Yes, the answer is periosteum, endosteum. Look at this question. Yes, I see you. I see you. Sorry, I've already called you. You know your name is sweet in my mouth. So, osteum. Okay, guys. That's the question is, when dash become enclosed in lacuna, they become cells called dash. These are the options. There are two questions there. They become when dash become enclosed in lacuna, they become cells called dash. A, osteogenic cells, osteoblasts. B, osteoblasts, osteoclasts. C, osteoblasts, osteocytes. D, osteocytes, osteoblasts, osteoclasts. Then E, osteocytes, osteoblasts. Come on, let's go, guys. Let's go, let's go, let's go, let's go, let's go, let's go, let's go. We're about to finish now. Don't tire out on me. Sanya, there are two answers there. Options: osteogenic osteoblast, osteoblast, osteoclast, osteoblast, osteocytes, osteocytes, osteocyte class, osteoclast, osteocytes, osteoblasts. Yes, you guys are correct. The answer is blast and sites. Blast and sites. When the osteoblasts become enclosed in the lacuna, they become osteocytes. I told you this now. Anytime you hear lacuna, just know it's sites. Sometimes it's other sites. Remember, the bone forming cells are the blasts. Blasts form class breakdown. Do you understand? Blast form class breakdown. Extremely important that you know this. Blast forms class breakdown. How about this? Which of the following is an inorganic component of a bone matrix? We have proteoglycans, we have glycoproteins, we have collagen, we have hydroxyapatites, we have glycosaminoglycans. Answer. You need to be paying attention now. What was the answer? These are the options. Yes, C is correct for that answer. It's the blastocyst. This is the question. This option for this answer. Which of the following is an inorganic component of the bone matrix? We have A, proteoglycans, B, glycoproteins, C, collagen, Z, hydroxyapatites, and E, glycosaminoglycans. Which one is inorganic? Come on, guys. I need more people to make this thing. Don't get lazy. Yes, the answer is hydroxyapatites. Look at this question. I just gave you the options first. Then let me give you the question. Yes, hydroxyapatites. This is the question. Hold on. This is the question. The hardness of a bone comes from dash, whereas dash provides some degree of flexibility. The hardness of a bone comes from dash, whereas dash provides some degree of flexibility. We have hydroxyapatite and other minerals, proteins, where we have collagen and elastic fibers, minerals. We have glycoproteins, proteoglycans. We have calcium carbonate, calcium phosphate. We have what? Proteins, calcium. Quickly, guys, quickly. I have very few questions to go. Quickly, guys. Not sure, okay. So yes, the hardness of a bone comes from what? The hydroxyapatites and other minerals, all right? Whereas, the proteins are the ones that offer a degree of flexibility. So just learn that today, all right? Learn that today, extremely important. Yes. So look at this question. Don't worry, a few questions to go. That's the option. I just posted the option first. So I want to post the question itself. So that's the question. The plasma membrane of DASH have a ruffled border with many deep infoldings, whereas DASH have long, thin finger-like cytoplasmic dendrites. What's the answer? Osteoclast, osteocytes, osteocytes, osteoclast, osteoblasts, osteoclasts, osteoblasts, osteocytes, osteocytes, osteogenic cells. Quickly, guys. Which one is the correct answer to our question? Correct answer to our question. Come on, guys. Yes, the answer is osteoclast osteocytes. That one is very straightforward. Look at this question. Which one we have using that option there that you saw? That option from the prior questions. Yes, the answer A is correct. Using the answer for options from the prior listing, which one of the, just pick one quick answer. Which one of the following bone cells would have the greatest number of lysosomes? Osteoblast, osteoclast, osteocyte, osteogenic cell, stem cell. Which one? Which one, guys? Let's hurry. Let's hurry. I need to sleep because I'm going for MRI tomorrow. So I'm going very early. I picked a very early listing because tomorrow is a very long day for me. So you guys need to hurry up so that we can finish. I'll give you 5 more questions and we're done. So the one that has lysosomes is osteoclast. So you're correct because it helps to break down. Lysosome is an enzyme that breaks down. Look at this question. It is common to find dash in compact bone, but they are not seen in spongy bone. Say the spirit is tired. Options: lamella, B, osteoclast, C, lacuna, D, central canal, E, osteocytes. It's common to find dash in compact bone, but they are not seen in spongy bone. A, lamella, B, osteoclast, C, lacuna, D, central canals, and E, osteocytes. Osteocytes. My battery is dying. Come on, guys. What's the answer? Yes, the answer is central canal. See, the difference is just lies in how they are organized, right? The organization, how they are organized, that's how they receive nutrients. All right. Look at this thing now. You see this thing? If you see how thick this thing is, so let's assume that this is a compact bone. If you want to put blood in this thing or put fluid in this thing, for it to have fluid, what do? You understand? Because it's a compact bone, you understand? The tissue is very dense and thick. You understand? So nutrients can not easily diffuse. You understand? Through the this solid calcified matrix. You understand? So because of that, compact bones like this are, they are structured into units called what? Osteons. So those osteons, another name for osteons is Haversian system. Yeah. So just like this. So at the center of the Haversian system, what do you have? You have what? The central canal. So this central canal is where the nutrients and the blood move through. So it now be distributing to everybody, because without it, it's too thick for blood to penetrate. But assuming this is spongy bone, look at this, my shirt. Let's assume this spongy bone. You can easily just pour water on it and it will soak, right? Surrounded by a lot of blood vessels. You understand? So because of that, it does not need a central canal. You understand? Where fluid, blood will be moving through. So that's how you need to think about it. Hope it makes sense. I hope. So look at this question. Look at this question. On the options, canals. So look at the options. The spaces found within the concentric lamella are called dash and they contain dash. A. Canaliculi osteoblasts. B. Osteon stem cells. C. Lacuna osteocytes. D. Lacuna osteoclasts. E. Central canals osteocytes. Answer. Quickly, guys. Let's go. 2:51. 2 minutes, 51 seconds. I want to stop immediately. It's 3 hours. I want to stop. So in the next 9 minutes. Finally, Alex is here. Alex will laugh now and say, Nchebe. Yes, the answer is C. Lacuna osteocytes. Anything in the lacuna is osteocytes. Extremely important. So 2 more questions to go. Nah, but this thing is going to come out though. Midterm is usually 100 now. The spirit has not said anything. Spirit can even say 150. So look at this question, guys. Look at the question properly. I'll need you to take your time to read it. It's a little heavy. Take your time to read it so that you can get the answer quickly. I'm going to post the option. So the question says, achondroplastic dwarfism is a hereditary condition in which the long bones of the limbs fail to elongate normally because of reduced hyperplasia and hypertrophy of cartilage in the dash. We have primary ossification center, we have secondary ossification center, we have primary bone marrow, we have secondary bone marrow, we have the epiphyseal plate. Leave that in, leave it. It doesn't matter. Just let's answer this question. Come on, guys. Let's hurry up. Let's hurry up. I need to get off by. Listen. If you have a problem with the question, just tell me 911. I can actually explain if you have a problem. Not sure. Okay, so listen. Despite the fact that I don't know why you guys are refusing to attempt the question, but let me just explain to make this thing to move because I really need to go off. As when you guys are, faster, we could have, touched some other things, but I can just, what am I saying? Okay. When you talk about achondroplastic dwarfism, right, it's very common. You understand? It's genetic mutation that affects the endochondral ossification, right? If you know this, then you are good to go. You understand? So when we're talking about endochondral ossification, you understand? You are talking about, growth of long bones. You get? Now, the site of this action is in the epiphyseal plate, and that's what they're asking you. That's the growth plate. When you're talking about epiphyseal plate, you're talking about the layer of hyaline cartilage. This is the see, this is the long bone. You see this line here. That's the epiphyseal plate. Do you understand? This is where hyaline cartilage is. That's why we are talking about endochondral ossification. All right. So this is the epiphyseal plate. You get it? You understand? It's the layer of hyaline cartilage, located between the epiphysis and the diaphysis. Epiphysis and the diaphysis of a child's bone. You understand? If it's an adult, it will no longer be epiphyseal plate. It will be epiphyseal line. Mind you. All right. Now, when you're talking about hyperplasia and hypertrophy, I told you anything plasia is just like me giving birth to a lot of children to fill this room, multiplication. But when you're talking about hypertrophy, it's just me eating a lot of food. All of you bring all your food from your house and I'm eating it and I get so fat and I cover this room. That's hypertrophy. Now, Hyperplasia is rapid cell division, right? To create more cells. While hypertrophy is just talking about enlargement. You understand? So for a bone to elongate, the chondrocyte, that's the cells, the cartilage cells, right, in the growth plate must undergo hypertrophy and hyperplasia. So you must give birth to children, a lot of children, that's increase in size, and those children must increase in quantity, that's multiplication, that's hyperplasia, and those children must what? Increase in size, that's hypertrophy. So in terms of achondroplasia, that's achondroplastic dwarfism, right? The chondrocytes in the zone of proliferation and zone of hypertrophy fail to multiply and enlarge at a normal rate. Do you understand? It fails to multiply and enlarge at the normal rate. Because another question may be asking you which zones are affected in achondroplastic what? Dwarfism. And you are telling them that it is what? Zone of hypertrophy and zone of what? Proliferation. That zone of proliferation is where hyperplasia takes place. That's proliferation, increase in quantity. Why zone of hypertrophy is increasing what? Size. When the two of them fail, that's when we have what? Achondroplastic what? Dwarfism. You understand? So the cartilage will no longer what? Expand. And you see the child, significantly short limb. Short limb. The femur and the humerus will be short because it's usually in the long bones. Feel me? Yeah. I believe you do. So you guys should remember that. So that's epiphyseal plate. We've talked about this. Yes. We've talked about so anytime you're talking about endochondral ossification, right? The precursor, you understand? The precursor connective tissue is usually what? Hyaline cartilage. Hyaline cartilage. Then we ask you this as a question, no? Just that I don't want to waste time asking the question because you guys are taking long to respond. So that's why I'm just pushing faster. I've already mentioned there is a question here. They say chondrocytes multiply in the zone of dash of the metaphysis. I've already said it's the zone of cell proliferation. That's where hyperplasia happens. Yes, I remember I told you about Wolff's law. Who can tell me? Wolff's law. Wolff's law of bone explains the effect of what? What does it explain? The effect of what? Let me give you options. Yeah. This is A. This is B. This is C. This is D. And this is E. Come on, guys. Yes, you guys are very correct. The answer is mechanical stress on bone remodeling. That's Wolff's law. You have to remember that. Okay. You also need to know some of this. Look at this question, guys, quickly. Yes, the answer is mechanical stress on bone. Yeah. This is A. This is B. This is C. This is D. And this is E. So which of the following is not a function of parathyroid hormone? Which one is not a function of parathyroid hormone? Yes, you guys are so correct. The answer is C. It doesn't lower blood calcium. It increases it. What it lowers is blood phosphates. All right, that's why I call it phosphate trashing hormone. So that's why they said nuts. All right. So this is A for this question. This is the final question now. This is B. I'm supposed to give you diagrams, but you guys are not answering fast, so I doubt if I can do that now. This is C. Oh, you are 16 already. Interesting. This is D. This is E. Quickly. What's the answer? Blood calcium deficiency stimulates dash secretion, which leads to dash. Quickly, guys. Yes, you guys are so correct. The answer is parathyroid hormone. Blood calcium deficiency stimulates parathyroid hormone because once the calcium is low, parathyroid hormone comes, pushes out phosphates and brings in calcium, right? Which leads to what? Increased osteo. And calcium will, and also, it also breaks down, causes, tells osteoclasts to go and break down bone. When it breaks down the bone, the breakdown elements, like the broken down element, that's calcium, will be poured into the blood. So thereby increasing blood what? Calcium. So everything that parathyroid hormone does is just to increase what? Calcium. So you should remember that. Okay. Oh boy. Okay, yes, the answer is C. So I want to view some diagrams quickly. I want to give you some diagrams quickly so that so look at this diagram. You need to go study it. To go study the diagram. So I won't be asking you because you guys take a lot of time too. So you just need to let me see what you need to know. If this were the fame of a 10-year-old child, where would red bone marrow be found? So guys, answer. Let me see if you guys are still active, because if not, I will just post pictures and disappear. This is the question. If this were the fame of a 10-year-old child, where would the red bone marrow be found? You see, you guys are wasting my time. So you guys are taking forever to talk. So like, go and study that bone. All right. So I'm expecting very fast response, because if you're in exam hall, you need to respond very fast. So look at this. Look at this, guys. See this? You also need to go know this. And yes, B and C is correct in that question. B and C is correct in that question. No, you people are wasting time, please. They will ask you other questions in that, so you figure it out. B and C, yes, is correct in that question, yes. They will also ask you, where would root bone marrow be found in adults? In adults, where will it be found? My network? It's not my network. It's not my network, because I'm seeing myself exactly what I'm saying on the YouTube. So it's not my network. So in adults, where will red bone marrow be found? Me. It's not. In adults, where will red bone marrow be found? In children, a 10-year-old child is B and C, right? Yes, we agreed on that. But in adults, where will it be found? No, not this photo now. The other one. I decided to go back to the other one, since you guys have started responding. This one, where will it be found? For adults. Red bone marrow, where will it be found for adults? Yes, B. Yes, B. You're correct. B. me see if there's another question they asked there. So B. Okay, they asked what type of growth occurred in E. What type of growth occurred in E? A, interstitial, B, appositional, C, okay, C, intrastitial. The first one is interstitial, appositional, intrastitial, periosteal, endosteal. What type of growth occurred in E? Yes, the answer is interstitial. There's nothing like intrastitial. That one is even out. All right. Then periosteal and endosteal are not types of growth. Instead, they are locations. All right. So those two are out. Appositional is surface of a bone, right? Especially old bone. So as position is out. But this is interstitial because interstitial is a growth that occurs where in the epiphyseal what plate. So it's always you understand. And if you look at where he is pointing at the epiphyseal plate. Do you understand? So that's how you get the answer to that question. So over to this one. They ask questions like, which cell is responsible for bone deposition? This one everybody knows. Which cell is responsible for bone deposition? Which cell is responsible for bone resorption? B is for deposition, E is for resorption. Yes, you're correct. Which cell, okay, answer this question. Which cell is stimulated by the hormones calcitriol and PTH? Which cell is stimulated by the hormones calcitriol and PTH? Yes, the answer is what? E, because E is osteoclast, so it makes sense. All right, the answer is E. E is osteoclast. It makes sense because both parathyroid hormone and calcitriol. You know what calcitriol is? Calcitriol is the active form of vitamin D, correct? So both of them, they work together to do what? To increase blood calcium levels. So when calcium is low, the hormones are stimulated. You understand? So bone resorption, mineral release, calcium elevation. All right. So when you're talking about osteogenesis cells, it's just stem cells. Osteoblast is bone forming. Osteocyte is just mature bone that is trapped in what? In the lacuna. All right. Okay. Let's see. Is that all for that picture? Okay, I've said resorption. Okay. Aha, go and study this image. Go and study this image very, very well. See this image? I guess you can see it. I believe you can see the image very, very well. Yes, I believe you can see it very well. So let me see kind of questions they asked. So they ask questions like which hormones is represented by B? You understand? You should know that. Which hormone is, guys, which hormone is represented by B? Which hormone is represented by B from this diagram? Perfect. The answer is calcitonin. The others are still thinking. Now, look at this question. Hypersecretion of which hormone would result in hypocalcemia? Yes, it's calcitonin because it's opposite effects. Look at this one. Which hormone is represented by A? Yes, that answer is B. That's calcitonin. Which one is represented by A? Calcitriol. Yes, you're correct. You are so right. For bone, the last image for bone is this. Look at the last image for bone. You understand? You should be able to know what A is, B is, C is, D is, you know? Should be able to, in terms of fracture. We already discussed it during the question. You understand? Like, calcitriol. You understand? We already discussed it during the class. You understand? But they are more particular about A and B. You understand? A is hematoma, B is fibrocartilage. Okay, so let me give you a few questions Yes, hematoma, and B is fibrocartilage. Let me give you a few questions on mm, chapter 11, muscular tissue. Diagrams of muscular tissue. So these ones are just very straightforward diagrams. You understand? So see this diagram. Please go study this diagram. Know all those labeled parts. They will ask you questions like, what is stored within the organelle C? All right. What is stored within organelle C? You should know what C is. The cytoplasmic reticulum, you know what is stored there. Then what organelle? What is the organelle A? Organelle at A primarily composed of? You understand? That's muscle fiber. It's usually proteins. Everybody knows this. Um, Myofilaments, rather. It's proteins. What is the structure at E primarily composed of? Where is E? E. Oh, okay, guys. What is the answer to that question? What is the structure at E primarily composed of? We already know that A is primarily composed of protein. You understand? Because those things are myofilaments. What is E primarily composed of? We have proteins, we have glycoproteins, we have phospholipids, we have adipose, we have dense regular connective tissue. The color alone self has given it out. Exactly, phospholipids. So I'll give you one of the most important diagrams. Look at it here. You should be able to identify this diagram by heart. You are expected to know it by heart. Yeah, phospholipid is correct for that answer. They will ask you about C. What is C? You should know what C is. They will ask you about dark bands. Which one is dark bands? They will ask you about the name of the structure in the middle of D. All right, this is D here. Oh, this is D here. They're asking about this structure, the name of the structure. Hmm. Yes, that's it. So look at this question. You should be able to know what is happening here. You are expected to know it's 100% what is happening here. Like they can ask you what is contained within the structure B. You look at B, is it not vesicle? So what should be inside? You understand? What should be inside the vesicles? Then you can ask you when the structure of a D opens, what does it let into the cell? Where is D again? Aha. Aha. So when acetylcholine matches with the receptor, that thing is pointing to the sodium channels, right? Aha. So when it opens, what rushes into the cell? You should know this. They can ask you what is contained in E. You understand? It's just the sarcoplasm, just the internal environment of the cell. Yes. Sarcoplasm. Okay. Look at this one. I think it should be the last. See this diagram, you must know this diagram. They can ask you questions like, what type of contraction is pictured at A? What type of contraction, in which contraction is the muscle containing tension while getting longer? Which one? That's the only thing they can ask you there. And that is how we come to the end of our discussion. Any question for me? Any questions for me? No, thank you so much. So just please, I want you to go back and review it, especially these last parts, because most of you were already dozing off. I caught somebody dozing. I can see you. The spirit makes me see beyond this screen. You understand? So please, I'll need you to go back, look at it all over again. Watch this video many times. The bulk of your questions are going to come out from these two chapters. Then go and watch all the other two reviews that we did, because questions are going to come out from them as well. You understand? Questions is coming from everywhere. This is midterm. Thank you so much, Afua. Thank you, everybody. Yeah, you guys are the best. So this is midterms. Midterm. Please go to the channel, watch those things as many times as possible. No matter who your professor is, it's still the same thing. Muscle contraction is muscle contraction. Cells is cells. Muscular dystrophy is muscular dystrophy. No matter who is teaching you, no matter your country, no matter your school. All right. So I will encourage you guys to take your time, come back. Don't just depend on only what we did here. Come back and review it over and over again. All right. So thank you very much. I'm going to log out now because I need to do something extremely important before I sleep. Yeah. So that's it. Thank you. Have a nice night. All right. I'm going to remove the stream. I'm going to end the stream now. All right. Good night. Thank you. Thank you. Good night.